all done here, and I'm going to leave it to the experts to get you arranged in the way that will be optimally. Your photos right now, we will take a photo at the end where we'll make sure that everyone is smiling and looks great. I'm Terry Harvath. I'm the Executive Associate Dean here in the Betty Irene Moore School of Nursing, and I want to welcome you all for being here. Associate Dean for Clinical Education and Programs, Elizabeth Rice, sends her regards. She's And while one phase of your journey is over, another is beginning. The need for primary care providers in California exceeds the supply. California faces a looming shortage of primary care clinicians in the coming decades, and if we continue along our current path, more and more Californians will need to visit the emergency room for conditions like asthma, ear infections, and flu because they lack a primary care provider. So you're filling an important gap in our healthcare system as you graduate and take your positions out in the community. In a short while, you'll be sitting for the PANCE exam in order to become licensed as physician assistants. In doing so, you're signing a social contract being a healthcare provider. The oath that you're about to take is one that is not just words, but evidence of your willingness to accept both the privileges as well as the responsibilities that come with becoming a member of this esteemed profession. I wish you well on the PANCE exam and in your careers. I would now like to invite Interim Director of the Physician Assistant Program, Dr. Jeff Pearl, to the podium.
Wow, you guys clean up pretty nicely there. Well, congratulations on starting your career as PAs. I know you worked very hard to get here, and we're very proud of that. I just wanted to say a few words. I kind of want to start to say that obviously there was a spark, an enthusiasm, compassion that we both saw in you to admit you to this program, and that you really, more importantly, saw in yourself of why you chose this as your career. I encourage you to really read and take to heart the oath that you're about to take today, and really help it guide you in your practice, not only in the good times, but some of the more challenging times that you undoubtedly encounter in healthcare. You've learned a lot about diseases, you've learned various clinical skills, you've learned from your preceptors, your patients, the student-run clinics, your standardized patients, and on rotations. And throughout that time, I hope that the preceptors, the faculty here, and your own inner humanity have modeled how you're going to practice with compassion and caring. In a few minutes when you recite the oath, I wanted to comment on a few lines in there I thought are really quite important. First, you're going to say that with honesty and dedication. So I want to talk about honesty. That's really to be honest with yourself. It's about what you do know and what you don't know. We've talked to you a lot that you don't know everything, none of us do. Know your strengths and your limitations. Be honest with your patients and with your colleagues. Admit fault and mistakes freely and learn from them. And never cut corners or compromise. The next word in there that in the oath that I thought was quite relevant was dedication. Now, what does that mean? Well, it means to work hard as if you were the patient and how you would want your provider to work for you. It's never settling for average or just enough, but always being excellent and continue to improve in your practice. And part of this means sacrifice. It means giving up time, sometimes outside plans, changing your social life, your family life for the benefit of your patients, being flexible, staying late sometimes, and really going that extra mile for your patients' benefit, that dedication that we all expect. Another line I thought was really relevant, that's not only relevant to this profession, but for particular emphasis at UC Davis and the programs we have here, is that I will treat equally all persons who seek my care. This is really an ancient tradition in healthcare and paramount to the advancement of all of us as a society. And this not only includes your patients, but their families, your colleagues, your co-workers, and all that you come in contact with when working in healthcare. I think it's important to always remember why you went into this field, what you wrote on your application statements. There's really caring and compassion and wanting to help the lives of others. Sometimes when we practice, we lose sight of that when it's busy, when we're tired, when things aren't going well, and just always kind of get back to that, and it'll all be okay. A quote that I always have used when I used to do these graduations, it's kind of a well-known quote, but I think it's really relevant, by Maya Angelou. It's that people may not remember what you said or what you did, but they're always going to remember how you make them feel. So I think taking that attitude, seeing the good in all and their potential, and striving to the best you can be, will lead you to a really fulfilling and successful career as PAs. And that journey starts now. Once again, congratulations. The faculty and I are very, very proud of all your accomplishments. Thank you.
Thank you, Jeff. I would now like to invite 2016 Master of Health Services Physician Assistant Studies graduate Carly Hustride to the podium. Carly.
Thanks for having me. I know you guys don't quite know who I am, maybe a few of you. But I can certainly echo what Dr. Pearl was saying with feeling a little exhausted, because I definitely had clinic today, came from clinic, and most days when I leave, I just think, wow, today was really tough, but I love what I do. So good afternoon and congrats to all of you for making it here today. Again, my name's Carly, and I'm a proud PA alumni of Betty Irene Moore School of Nursing as of 2016 and practicing since as a PA in endocrinology. So I want to provide you with 3 pieces of wisdom that have been passed to me that I hope will benefit you in some way as you enter this new season. So the first is this, probably a little unexpected and hopefully pay off your debt. Of course, with great education often comes a great cost for most of you, and I will be the minority in telling you to get rid of your student loans as quickly as possible. You won't regret it. I don't. Okay, so the next thing. And on a more serious note, connect. So take every opportunity to connect with your staff and with your patients. Do not let yourself be desensitized. Everyone has a story to tell, and I can say I often learn more from my patients than I offer to them. Many of them life experiences, joys, or tragedies, and I'm surprised by their resiliency and their strength. In fact, I recently had a patient who passed away. They had some form of cancer diagnosis, and really, really wonderful woman. Just reminded me that our time is short. So remember to connect with those around you. And lastly, same as Dr. Pearl said, but remember your why. Each of you has one, why you wanted to be a PA. And in those tough days when you wonder, why are you here, or what are you doing, remember your why and don't lose it. During my journey to become a PA, I had a mentor, and he was this lovely elderly gentleman. He was an 80-year-old retired pediatric oncologist, and he really inspired my why. He always reminded me of the saying, sometimes to cure, often to relieve, and always to console. And he lived by this rule. After all of his rounds, when he was working, he would sit with each mother of a child who was dying of cancer. And when he couldn't cure, and he honestly told me he didn't, and when he couldn't cure and he couldn't relieve the pain, all he could do was offer his time and his presence to those who needed it. And that was enough. So I remember that offering and sacrificing my time is my why, and everything else will follow. All right, so here's to all of you guys, and I'm available to you if you want to reach out. I hope you take it, all of it or a little, and wherever you go, I wish you the very, very best. Congrats, guys. You're awesome.
Thank you, Carly. I would now like to invite Associate Clinical Professor Virginia Haas to the podium to lead the students in the oath. Virginia.
like everyone has their oath. It's so exciting to be here with you all today. I remember many of you from your first day on campus when you interviewed, and I remember all of you from many wonderful classes together, and I'm so very proud to be able to call you all one of my colleagues now. So please follow along with me and say the oath with me. Yeah. I pledge to perform the following duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will treat equally all persons who seek my care. I will hold in confidence the information shared in the course of practicing medicine. I will assess my personal capabilities and limitations, striving always to improve my medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to an improved community. I will respect my professional relationship with the physician. I will share and expand the knowledge within the profession. These duties are pledged with sincerity and upon my honor. Thank you.
Congratulations. Again, we wish you well on your exam and most importantly on your careers. Please stay in touch. We want to hear how you're doing and what you find exciting as you walk into the world of becoming a physician assistant. Congratulations. So now we're going to get you in order for a photo and then